name is Nikki, and I am a person in long-term recovery. I'm also a person that has made some terrible choices and some deplorable decisions. About 7.5 years ago, I was involved in a car accident that tragically ended with a young person losing their life. As I was driving home, I suddenly hit something. Instead of stopping to find out what had happened and help this person, I panicked and wrongfully drove about a mile down the road. I was charged with leaving the scene of an accident, death resulting as this person was passing on. A family was forced to deal with not only the immeasurable loss of their loved one, but also had justified anger for my failure to stop and do the right thing. Halfway through the 2.5 years that would take me to be sentenced for my crime, I began using heroin. Prior to this accident, I had struggled off and on with an addiction to pain medication, stemming from a domestic assault as men and women do. All these problems that I had were now compounded with an impending incarceration and, most importantly, a death. I was erratic, reckless. I'd gone entirely off the rails, and I needed to be removed from society. My judge addressed me at my sentencing in saying, "It takes fear to be brave, and you, McKee, you were not brave, you were selfish." She was absolutely right. This day, almost 5 years ago, was both the last day that I used drugs and the first day of my 19-month prison sentence. It was during this time that I met Michelle Harder, a peer recovery coach. We would meet regularly to talk about the things that had happened to me and also the things that I had done. Michelle would call me out on my distorted thinking, addictive reasoning, and would suggest coping mechanisms. While this wasn't always easy to hear, it was necessary and had a profound effect on me. This was the beginning of my recovery. I was released to home confinement in 2015 and was able to obtain work full-time through open-minded employers and also enrolled in school. Today I'm a straight A student at Rhode Island College working towards a bachelor's degree in psychology and another bachelor's degree in chemical dependency and addiction studies. I'll be applying to PhD programs next year in hopes of becoming a psychologist. I have wonderful parents and friends that don't have to worry about me. I try to lead by example with those who are struggling with addiction. In the last few months since my ankle bracelet has come off, I've been able to become involved with the recovery community. Most importantly, I now exercise self-efficacy so that I can help instead of hurt. I'm really trying to be brave. I know that I'm very lucky and that I have a lot to be grateful for. Not only did I survive this epidemic, I was also given a second chance. And there are a great many others that, when faced with the gift of desperation, listen, recover, and seek not only to re-enter but to enhance our communities. It is because of lived experience that I am opposed to the drug-induced homicide bill. While it was likely created with good intentions, this law surely would have devastating effects on those who are struggling with this disease and are most at risk of fatal overdose. The people who created the drug-induced homicide bill claim that it targets drug kingpins and not low-level distributors, but the wording of it suggests otherwise. The law casts such a wide net that it could potentially apply to most of the population in active addiction. An 18-year-old kid that sells his classmate a $25 bag of fentanyl-laced drugs could be charged with felony murder and sentenced to 25 years in prison. This is more likely if this person is Black or Hispanic. This is a murder charge. Without intent to kill or knowledge of the lethality of a substance, this is a murder charge. Based on this line of reasoning, every drug deal that doesn't end tragically would qualify as attempted murder. But let's not give the AG's office any ideas. This is a bill created out of pure emotional reactivity that seeks to assign full blame to individuals regardless of the victim's willingness or the possible presence of other substances in their body. It doesn't capture the complexity of this disease that is cunning, baffling, and powerful. Steep prison sentences leave an individual broken and institutionalized. It is outside of those walls that we can pay our debts to society and try to honor those whose lives were lost or affected by our wrongdoings. Hastily amending this bill to include the Good Samaritan law in an effort to get this passed may be futile for those who we hope will utilize it. This was designed to serve as a deterrent for drug dealers, but our failed war on drugs has proven that these severe scare tactics do not work. People in active addiction are warned about the danger of using drugs alone and are encouraged to have another person present to administer naloxone and call emergency medical care if an overdose should occur. The other person is sometimes the determining factor as to whether someone lives or dies. Overdose from fentanyl and other substances occurs frequently, and by all accounts of people who have witnessed, it is terrifying. I spoke with someone in recovery just a few days ago who had a friend overdose in their home after a relapse. This person recounted how their friend keeled over and instantly started turning blue. And despite not having sold their friend the substances that nearly killed them, or even having used any of them, this person did not know what to do, and this is a typical response. We've only just started to get away from focusing on the criminality of this issue and have begun addressing it as a public health emergency. A police officer in Burrillville Town Hall meeting last week expressed that you can walk into their police station, hand over your paraphernalia, ask for help, and help will be given. Law enforcement is a big piece to this puzzle and a part of the solution. Putting fear and a threat of a life sentence could deter someone from calling 911 for a friend or loved one in the event of an overdose. Rhode Island has become the gold standard for solutions to the opioid epidemic. Despite the substances in circulation becoming increasingly lethal, the state has seen a decrease in overdose deaths. This is due to the collaborative and innovative efforts of the medical community, law enforcement, the governor's task force, and the recovery community. In our state, every day, there are people meeting those struggling with drug addiction where they're at to distribute Narcan. When a person does overdose, there is another human being that sits by their hospital bed to talk in hopes that the suffering person will start getting treatment. This is amazing. I would ask Governor Raimondo to oppose the drug-induced homicide bill. This law would only perpetuate stigmas associated with this disease and further marginalize those living with addiction, consequently putting them at a greater risk of fatal overdose. The drug-induced homicide law does not fit the current narrative of hope, progress, and recovery that every Rhode Islander living with this disease should have the opportunity to live to experience.